Hi, I'm Jeremy Deeroff. I'm an internal medicine veterinary specialist. We have today Teresa, who's a diabetic cat, and Megan, who is one of the internal medicine nurses, and we're going to show you how to draw up insulin and give insulin injections to a cat. All needles have what's called a bevel. There's a sharp side and a more of an open side. You always want to try and put the sharpest point of the needle or the bevel so that the bevel's up and the sharp point of the needle is going to touch the skin first. What we're trying to do is inject the insulin into what's called the subcutaneous space. It's the spot between the skin and the body wall. There's a pretty decent amount of space between there. In most animals, we have a lot less in our skin, but cats and dogs have a decent sub-Q space. What we typically recommend doing is pinching up on the skin to what we call tent the skin and basically make a triangle that we're going to then put our needle in. So bevel up, we're going to gently tent the skin, and we're going to gently and carefully push the needle through the skin, which you'll usually get a very mild reaction. And in an insulin needle, we don't tend to pull back on the syringe to what's called aspirate it. We just go ahead, once we think we're in, we're gonna watch very carefully, and we're gonna slowly and carefully push in on the plunger and then pull the needle and syringe out completely. You always want to inspect the area to make sure that it's not wet. If there's a wet spot in on the skin, we probably did not inject the insulin through the skin and maybe onto the skin. You'd need to talk to your veterinarian about what you do about that. My recommendation is if you think you accidentally messed up and didn't give the whole injection through into the skin, you go ahead and try again the next time they're due, but you don't give them more insulin now because you never want to overdose them. Once this insulin needle is done and used, you want to put it in a proper sharps container. We typically have owners put them in an old used milk container and save all their old syringes to bring back into the clinic to dispose of them in a proper sharps container. But you never want to reuse insulin needles. One, they're dull. They're going to hurt the patient once they dull, but they're also then contaminated, so we can also start injecting and introducing bacteria.